So today, we're going to dive into one of the most critical procedures in all of medicine. I mean truly, securing a patient's airway. When someone can't breathe, this one skill can literally be the only thing standing between life and death. It is, in every sense of the word, a lifeline.
I mean, just think about that for a second. It's probably the most fundamental, most terrifying question in emergency medicine. When a person can't get air, the body's clock starts ticking down with incredible speed. Every single second matters. And it's right there, in that moment of crisis, that our story really begins.
So, before we get into the how of this procedure, we really need to understand the why. What are those make or break moments when a medical team has no choice but to step in and completely take over a patient's breathing?
And when you look at this list, wow. You see just how many different things can go wrong. It could be something like respiratory failure from a nasty lung infection, a cardiac arrest where the whole system is shutting down, or even horrific burns that cause the airway to swell shut. The one thing they all have in common? The body's ability to get oxygen is failing. Fast. Intervention isn't just an option. It's absolutely essential for survival.
So when these crises hit, what's the answer? Well, medical teams turn to a definitive procedure, a skill that's designed to solve this one massive problem directly and effectively. And that's called endotracheal intubation.
And here it is, endotracheal intubation. You know, at its core, it's all about creating an open, protected highway for air to travel straight into the lungs. The whole procedure involves carefully guiding a special tube, called an endotracheal tube, down into the windpipe, also known as the trachea. And here's the crucial part. It doesn't matter what the problem is. Could be swelling, a physical blockage, or the patient is unconscious and has lost muscle control. This tube creates a bypass. It's a direct, secure tunnel from an oxygen source right to the lungs. It's so elegantly simple in its goal, but boy, it requires a ton of skill to actually do it right.
You wouldn't want a pilot to just wing it before takeoff, right? Well, it's the same idea here. The medical team goes through this meticulous checklist. Preparation is absolutely everything to make sure this procedure is done safely and successfully, especially when the pressure is on.
So the very first step, before anyone even thinks about picking up a piece of equipment, is to assess the patient's unique anatomy. Clinicians use all these different techniques to try and predict how difficult the intubation might be. Are they going to be able to see the vocal cords? Is the tube going to pass easily? This whole assessment is about spotting challenges before they become big problems.
And you can see just how specific this gets. I mean, they're taking actual measurements. Take that mental distance, for example. That's the space from the tip of the chin to the Adam's apple. That little number can tell them a lot about how easily they'll be able to line everything up for a clear view. These numbers help create a mental roadmap of the patient's airway. Okay, the patient's been assessed. Now it's time to assemble the toolkit. And everything has to be right there, within arm's reach. You've got suction to clear things out, an oxygen source ready to go, and of course, the laryngoscope. That's the critical tool they use to actually get a direct line of sight to the vocal cords, which is basically the gateway to the windpipe.
All right, let's say the tube is in, but is it in the right place? This next part, confirmation, is, you could argue, the single most critical step of the whole thing. There is zero room for error here. Getting it right is everything.
And here's why it's so tricky. You have to picture this. The windpipe splits into two paths, like a fork in the road, one for each lung. Because of the angle of that split, if you push the tube in just a little bit too far, it almost always goes down the right side. And that means only one lung is getting air, which is a major, major problem.
So, to avoid that pitfall, and others, clinicians use a whole series of redundant checks. It's all about layers of safety. Did they physically see it pass through the vocal cords? Is there mist in the tube when the patient exhales? Is the chest rising evenly on both sides? Is the oxygen level going up? Each check is another confirmation that they're in the right spot.
You know, one of the most classic checks is just listening, using a stethoscope. And the difference is like night and day. If the tube is in the right spot, you hear clear, equal breath sounds over both sides of the chest. But if you hear gurgling sounds over the stomach, that means the tube went down the esophagus, the food pipe. That's a critical sign to pull it out immediately and start over.
But, of all the methods, there is one that's considered the undisputed gold standard for confirmation. It's called waveform capnography. Basically, this little device measures the carbon dioxide in a patient's exhaled breath. It's super simple. If you're getting a CO2 reading, you are, without a doubt, in the lungs. Why? Because the stomach doesn't exhale carbon dioxide.
This makes it the single most reliable proof you can get.
So, we've walked through how the procedure is supposed to go, but what happens when things don't go to plan? What happens when a patient's anatomy, or the situation itself, presents the ultimate challenge?
Well, that's what's known as a difficult intubation. It's a situation where even a really skilled, highly trained professional runs into trouble. And the key words here are anticipated or unanticipated. Sometimes they know it's going to be tough based on that initial assessment, but other times it's a complete surprise, a challenge that requires incredible skill, quick thinking, and a whole different set of strategies to overcome.
So, we end up back here. At first glance, it just looks like a simple plastic tube, right? But placing it correctly, under immense pressure, is a procedure that stands right at the crossroads of anatomy, technical skill, and staying calm in a crisis. It is without a doubt one of the most critical skills in all of medicine.